color coding of the IV cannulae. So the largest, one thing to note is that the number is low. If the number is low, that means the size is high. So number is low, it just means it is inversely related that the size is increased. So if you look at 14G, it is actually the biggest, and this is orange in color. It's orange. And now if you look at the flow rate, it is about 270 ml per minute, and this is mainly used in case of trauma patients and in case of large volume replacement. Then if you see, there's 16G. 16G, it is gray. Okay, so gray here, it indicates slightly lower, that's 236. This is also used in case of the trauma patients. It's used in case of trauma patients as well as the major surgeries. It is also used in case of GI bleeds, gastrointestinal bleed, as well as in case of postpartum, and in case of blood transfers, multiple blood transfers, and the high fluids, high volume of fluids. Next, there is the 17G. So in case of 17G, what is seen is it is white in color. 17G is white in color, and the amount that is transferred is about 125 ml per minute. And now next one being 18G. In case of 18G, it is green. It is commonly used. It is green in color, and it transfers about 103 ml per minute. Now what it does, it is used for blood products, and it is used to deliver the irritant medication. Irritant meds can be transferred, as well as in case of the contrast study as well as in case of surgeries, it is used. Then moving on to the 20G. 20G, if you see, it is pink in color. And the rate at which it is transferred is 67 ml per minute. So if you see, 18 is 100, and below 18 it is below 100. So it is 67 here. So the pink, if you see 20G, it is general use in case of IV, and it is used for IV antibiotics as well as the IV analgesics. All this is done by 20G, and it is pink in color. Then we are moving on to the 22G. 22G, if you see, it is blue in color. It is blue. And the size, if you see, what is transferred is 42 ml per minute. So this 22G that is in blue, it is used for the small as well as small and fragile veins, as well as in case of cytotoxic therapy. Now moving on to the next, the smaller ones, that is yellow. Yellow is for 24. It is 24G. So here the speed at which it transfers is 20 ml per minute, and yellow is specifically for the pediatric usage. Then moving on to the 26G. So in case of 26G, it is what in color? It is violet. It is violet in color, and it transfers about 13 ml per minute. And this is recently added